ನಮಸ್ಕಾರ ಡಾಕ್ಟರ್ ಅರ್ಚನಾ ಅವರೇ, ಹೇಗಿದ್ದೀರಾ? ಹೌ ಯು ಡೂಯಿಂಗ್?
All good, great.
ಶೇಖರ್ ಐ ಹಾಸ್ಪಿಟಲ್ ಅಲ್ಲಿ ಎಷ್ಟು ವರ್ಷದಿಂದ ಹೌ ಲಾಂಗ್ ಹ್ಯಾವ್ ಯು ಬೀನ್ ವರ್ಕಿಂಗ್ ಡಾಕ್ಟರ್?
I've been here for 10 plus years and working as a cornea and refractive surgeon
Okay.
with special interest in dry eyes, refractive surgeries.
I'm just curious, what made you choose the eye department?
Eye is something very, it's a very curious organ. If you see, it's a small golf ball sized organ. So people will wonder what more is there in the eye. There's a lot more in eye. If you see, there are we have some 6 to 7 subspecialties in the eye itself.
Right.
So each part of the eye has a specialist.
Right.
It is that important.
Wow. Do you come from a family of doctors?
No, I don't have any medical background. Nobody in the family. Probably I'm the first doctor in my family.
Wonderful. That's wonderful. You're technically a visionary. If the vision. This is wonderful. So welcome. My name is Amit. Now, doctor, tell me, what do you specialize in when it comes to Shekhar Eye Hospital?
Yes, I'm a cornea and refractive surgeon here.
Okay.
So anything related to corneal diseases, management, and then related to refractive surgeries, like people who wear glasses, they are keen to get rid of the glasses. So we do the laser treatments, LASIK treatments. So I specialize in that.
And I think the most common issue with the weather, with body type, it's a very regular thing that we all talk about, which is the dryness in the eyes.
All about.
You must be seeing people on a daily basis, and
Yes.
and how many cases of different stories. And
In my clinic, I think 8 out of 10 patients present with some form of dryness. Either they know it or they don't know it that they are suffering from dry eyes, but they do present.
They do. And
Yes.
what is the age category? Is there an age bracket to this?
Maybe few years ago, I would have told you dryness mostly is persistent in maybe younger age group, middle age, the IT goers, IT professionals, or the seniors.
Right.
Now the scenario is completely changed.
Okay.
We see in pediatric age group, we see in kids, now it is persistent in all age groups.
Right.
Kids present with this computer vision syndrome or the digital eye strain, what we tell, we see it in kids, the middle age, the older age.
Wow.
That's because of the digital era, as you know.
And it's ruined everything
It is.
for our eyes.
Yes.
But it's just very difficult to stay away from it. But talking about the dryness, where does this start from? Tell me something, doctor. When this was the 90s, what was the reason why this dryness came up? And when it's now in this era and this generation, what's the reason? Whether it's the same reason or different reasons, but also different.
Yes, it's different now. If you're talking about 90s, it was not that digital era.
Correct.
We were not exposed to this much of gadgets and things,
Correct.
right?
Yes.
So it was mostly, dryness was not very prevalent then. People used to have dryness only if there was some underlying cause.
Okay.
Like they have some systemic illness.
Okay.
Like there are various reasons for dry eyes. One of the thing is some health issues, some underlying health issues like a thyroid problem, people with rheumatoid arthritis, autoimmune conditions, uncontrolled diabetes. People do present with dryness.
Okay.
All right, and weather changes.
Okay.
Somebody in a very hot place,
Correct.
summer, mostly it was that. But now if you see in this digital era, as I told, 8 out of 10 people present with dryness. And it is the first important cause we are seeing is the digital eye strain. I would rank it the first. That is the first cause of dryness, I can tell you.
Okay.
Then the other causes
Right.
will lie out.
So it just starts from the
It does.
digital space itself.
It
But when we talk about a young age from where the dryness starts, what is a possible youngest age where it could start?
School-born kids?
Schoolboy kids.
Definitely.
Let's say 5 to 6 years.
Yes.
5 to 6 years. Wow.
We have seen kids with that young also present with dryness. The symptoms are not clear cut because the kid cannot explain the symptoms. Parents don't know what's going on.
Correct.
All they notice is subtle symptoms like the kid is blinking a lot. He or she cannot stare at something for a longer time with the eyes open.
Right.
Constant tearing in the eye.
Okay.
They cannot face lights.
No.
Anything, even indoor lights are hurting them. They cannot keep their eyes open when they go out in the sunlight. These are the subtle symptoms which even the parents won't know why it's happening.
So eyes.
Dryness presents like this.
So eyes can't get completely exposed to a bright environment, and when it
Yes.
does, they feel those symptoms.
Yes,
People
one
feel
of the symptoms of dry eyes is eyes become very sensitive, intolerant to light, fan, AC. Night driving becomes very difficult for few people with oncoming headlights, and they don't know why it's happening.
Correct.
This is another common symptom of dry eyes.
Okay.
Intolerance to oncoming headlights,
Right.
glare and halos they see because the light spreads when it falls on the eye. Vision, people also do complain of blurred vision. Contact lens wearers, glass, they use the correct power of glasses, contact lenses, still they're not able to see well.
Correct.
So that's because maybe something to do with underlying cause of dry eyes.
And what is the first thing we would do about it, Dr. Rico, when we are experiencing all of these symptoms?
Yeah.
Of course, we visit a doctor. What are the remedies towards this?
See, finding out the root cause is very important. If you know it's your gadget usage, the increased screen time, digital eye strain is the reason for your dryness, handle that first. Alright, treating the root cause is very important. Treatment remains the same. Whatever is the cause, dryness, treatment is the same.
Right.
But handling the root cause is very important. If you are like the screen time is high, basic things like we always tell, follow the 20-20-20 rule.
Okay.
It sounds simple, but it does a great job for reducing this digital eye strain.
Okay.
All you have to do is every 20 minutes, take a 20-second break,
Okay.
look away from your screen, pretend like 20 feet away
Okay.
at some far object, blink your eyes, continue your work. That much time, this much rest is more than enough for the eye to recover.
So that's a 20-20-20
Rule. Yes.
Okay.
So when we are looking at any gadget, we do not blink.
Okay.
Blinking is an involuntary reflex.
Right.
You don't realize you're blinking,
Correct.
right? But when we are staring at something, we do not blink. So that is one of the reasons for the eyes to get dried up. The tears evaporate. For the tears, for the moisture to stay in the eye, blink is very important.
Okay.
For the tear production, when we blink, the tears produce from the tear glands and they help in spreading on the ocular surface, eye surface. So the blink reflex is very important. That is when this 20-20-20 helps.
Okay.
Yes.
But these are still people who are dealing with the digital part of it, where
Yes.
they go to work and they spend a lot of time
Right.
on their computers, laptops. Like,
Yes.
there are people like home on the other side with television and like
Yes.
there are these people who go working from home.
Yes.
It could be housewives or different categories.
It implies to all of them. 20-20 rule implies to all of them.
Everyone.
Yes.
Even serial, money includes on serial note that
Always better. Right. Always good for the eye.
Wow.
Take a commercial break.
I feel like eye doctor should come in between serials and say take a commercial. What do you prescribe, doctor, normally to patients like this?
Yes. When patients present to us with dry eyes, as I told you, we'll first evaluate the severity of dry eyes. We do some tests to check what is your tear level, whether dry spots are there on the eye, are your tear glands functioning well. We'll first assess the severity of the dry eye and then find out the underlying causes. Digital eye strain is one thing, so we ask them what is their routine and how much hours they spend on the in the work, because when we tell them this 20-20 rule, when they take a break they sit on the phone. Again, it's of no use. So we find out what is their routine. Next, we find out if there are any other underlying causes.
Okay.
We always evaluate. If the dry eyes is very severe, we do advise some blood test, some diagnostic test to find out if there's anything else happening in the body which is showing up in the ash.
Okay.
Many times patients present with some eye symptom, but there is something else happening which we have to definitely find out, and accordingly we can direct them to that specialist. So if that problem is handled, even the dry eyes will come under control. So we first diagnose what is the root cause, we evaluate what is the severity of the dry eye, Based on that, we start the treatment.
Based on whatever you evaluated or
Yes.
where it comes from.
Whether it is mild, moderate, severe,
Okay.
and then we start the treatment. The basic treatment will be giving moisture, extra moisture for the eye.
Correct.
So using some lubricating drops,
Correct.
artificial tears,
Correct.
which is the safest for the eye, because your eye is not producing good quality tears or quantity of tears. We have to substitute it with some tear substitutes. So lubricating drops is the most common thing we have to start off with.
So,
If there is any inflammation in the eye, we have to start off on some anti-inflammatory medications, sometimes with antibiotics, depending on what is the condition, or what is causing the dryness.
these are mostly by drops or injections or like
Most of them are in the form of eye drops.
eye drops.
Yes.
Okay.
Alright. So those are the things we start off with. Sometimes oral medications do help, like some supplements. We do evaluate for some vitamin deficiencies. Vitamin D is deficient, that can also show up as some dryness in the eyes. Supplements for that. Omega-3 fatty acids really help for dry eyes. So because they improve the tear glands, the oil tear glands in the eye. So the quality of that oil secretions is very important to retain the moisture. Like how we apply moisturizer on the skin to retain the moisture and how it is. So eyes themselves have a natural moisturizer. That is the outermost, the oily film of the tear. So to retain that, we give omega-3. So that's a very good supplement to be taken.
When it comes to omega-3, these are available from the regular food, regular diet that we consume.
Yes, lot of foods have good omega-3 content, like flax seeds, chia seeds.
Okay.
For fish eaters, salmon is a very good source of omega-3. There are a lot of other vegetarian sources which can be taken. But certain people may need supplements. The dietary intake may not be adequate, so we do give supplements. So they can talk to the doctor and take the necessary prescriptions.
Wow, this is, none of us knew there is so much behind the dryness. But there is something else that I was curious about. It is the sandpaper sensation. Take us through this. What does this mean, and what happens when the sensation happens?
Yes, this is a very common symptom of dry eyes.
Okay.
We call it as grittiness or sandpaper sensation in the eye. That's because the moisture content in the eye is less, and so every time you blink, you can feel that friction in the eye.
Okay.
Right? So blink reflex should be very smooth. If the moisture tears are good in the eye, you don't feel the blink. But if it is dry, you can actually feel the blink. So it is causing that sandy feeling or grittiness in the eye.
Friction in the feeling of friction, correct?
Yes. That makes a person so uncomfortable. They start rubbing their eyes,
Correct.
squeezing their eyes, in turn causing eye pain because your eye muscles get tired, end up with a headache. It's all connected.
So that's like the most common thing kids do, I must say.
Yes, kids also.
Because they keep rubbing, they could rub their eyes and and that is one side, and the other side is the redness.
Yes.
Most commonly, I think, even with layman on a daily basis, if you just walk out on the streets, I feel like one in at least like 20 people you would see.
Yes.
You'd see the person with red eyes.
Red eyes. Yes.
What contributes to this?
Again, as I told, for the ocular surface or the eye surface to be healthy, tear is the most important factor.
Okay.
It is a protective barrier. If the tears is not functioning well, your eyes become very sensitive, very prone to infections, prone to all the dust, pollution, whatever enters the eye. There is no protective barrier.
Correct.
So eyes become very sensitive.
Yeah.
And most common sign in the eye is the redness. The moment the eye is not comfortable, it presents as redness, irritation, water.
Okay, so this is again something to do with the moisturization.
Yes, everything related to that. I have patients who walk in and tell, Doctor, I don't drink, I don't smoke, but people keep telling my eyes are always red.
Yeah, I feel like people also connect the redness of eye with any kind of intoxication. Normally, saying you've consumed this, that's why you are nice. You've got which is the most common thing, and it's a joke. It's a running joke as well.
True.
But I think there are multiple reasons why, including sleep. I feel.
Yes. That's another important factor. Good, you brought up that topic.
Yeah.
Yes, lack of sleep does cause a lot of eye strain. There is no rest to the eye. Your eyes are congested. the blood vessels are dilated and it's not comfortable. So basically the eye is not comfortable, it will present as red eye.
Actually, and to give you a very honest statistical fact, I think this is my experience when I went to Kerala, Kochi. The police officers would catch people with red eyes because there's a very common assumption, misconception, I don't know, but automatically when they would see someone with red eyes, they would catch them. And so I've been told that these drops are being used to take that away from them. And I don't know where these drops are, these drops are bought. Is there a prescription for these drops to be bought? How does that work, doctor?
Yeah. See, there is something called as decongestant eye drops.
Okay.
Which act temporarily on the red eyes.
Okay.
Basically, they constrict those swollen blood vessels. Temporary relief. They give temporary relief from the redness. But it's not a good idea to use them on a regular basis because there is something called as rebound redness which happens. The moment people keep overusing it and when they stop it, the red eyes become very prominent. So that is something I would suggest not to be used.
Not to be.
First
it's customized with the person.
Yes. So it's always better to consult the doctor and then take the medications. Yes. Avoid using over-the-counter medications.
That's absolutely true, but again, that is where we're talking about social media playing a role in people buying these products for their eyes or whatever. I'm curious about this. I come from an industry where we present ourselves, we act, and we do a lot of other things. And there is a very common thing of dealing with lights, and then there is makeup as well. How does this happens on a daily basis, almost? And how does it impact eyes, and how do people be careful about it?
Yes, eye makeup. Is it safe for the eye? Can it be used?
Correct.
Yes, I always tell them if the product is suitable for you, you have been using it and it's not causing any allergic reaction in the eye, it's a good product from a good brand, there's no harm using it. All you have to take care is clean and remove the eye makeup before you go to bed. That's very important. Because whatever we apply is on the lid margins.
Correct.
They clog the pores. Those tear glands where the oil glands are located, they clog the pores. Always remove the eye makeup before you go to sleep so that you don't end up with infections. And even this dryness and all those things will not happen.
Do you think otherwise to protect ourselves from dryness, it might be useful to use glasses?
See, glasses will help if a person has some refractive error. A person has some power, a spectacle power, not able to see well, the glasses help. Otherwise, a protective goggle, if you are outdoors, exposed to a lot of dust, wind, sunlight, then a goggle will definitely help. It's a good idea to take a good UV protected sunglass or a wraparound kind of goggles if you are exposed to a lot of outdoor activities.
Got it. Yes. Understood. But when it comes to screen, do you recommend, like there are these specific screen glasses that women also pushing?
There is no harm using the blue filter glasses. If a person has power, spectacle number, it's always better to take the glasses with the number prescribed with the prescription.
Got it.
If somebody doesn't have any number, it's a zero power glass and they want to wear something to avoid the blue light, a blue filter glass is fine. There's no harm using it.
It's alright to use it, and it is also a trend wearing glasses. So do you suggest you wear it all the time or like wear it only when it's used?
See, but that is not the recommended thing to avoid dry eyes or anything. That's why I told there's no harm using it, but what has to be done has to be done.
Absolutely. And when it comes to irritation as well, I assume it's purely because of the lack of moisture in the eyes.
Yes.
And are there any very common reasons why these irritations happen?
Dryness is one very important cause. Allergies.
Allergies, okay.
Alright. Bangalore, people are prone to a lot of allergies. The pollen content is somehow very high. People, especially who migrate newly to Bangalore, they end up with a lot of allergies, respiratory allergies, related to even the eye. That also causes a lot of irritation in the eye. Plus the dust, pollution, exposure, those things. And then contact lens users also present with irritation in the eye if it is not used properly.
Correct.
And again, they have associated dry eye problem, allergy problem. Again, contact lens becomes a intolerance. Yes, it causes a lot of intolerance.
Is there a common thing you tell to your patients? Like, I believe if they come for if they are just coming to visit you, they state their problem and all of. Is there one common advice that you give them? Novelty.
Yes, I always tell them change your lifestyle.
That's the most.
Otherwise, no medicines will work. I'm telling you. There is medicine is not the answer for everything.
Yeah.
Our lifestyle matters a lot. What we do, how we treat ourselves, how we take care of ourselves,
Yeah.
what we eat, what we get exposed to matters a lot.
Yeah. Absolutely. But I hope me, my viewers, my listeners, all of us are going to take that seriously. But thank you so much for joining us, Dr. Archana. It was lovely having this conversation with you. You are a vision by yourself with the work that you do.
Thank you so much.
All the very best for whatever you do.
Thanks a lot. It was great having this conversation with you. Thank you so much for having me here.
Thank you.
Thank you.